Matthew Kavanagh joins us live now from Washington. He's the director of Georgetown University's Center for Global Health Policy and Politics. Professor Kavanagh, thank you very much for your time for speaking to us here at TRT World. Now, health authorities are tracing passengers still across several countries. Just how concerned should we be? The WHO is saying we shouldn't be too concerned because the risk to the general public is low. But what's your assessment?
The WHO is right. I mean, on the one hand, this is concerning because we have a virus that we thought was spread only by sustained and prolonged contact and mostly by from animals. And now we've got sustained human chains of transmission. So that's worrying, but it is nowhere near the scale that we would be talking about that would be a pandemic like COVID-19. We're not seeing that kind of explosive transmission. And so this is something that should be able to be contained. More concerning is what it means for the kind of global attention to pandemics and cooperation globally, which has not turned out to be nearly as strong as we might hope it would be.
The WHO guidelines for those passengers who are now back home, who are on board the ship but are now back home, are that they are all expected to isolate for 42 days. So they're meant to be in quarantine for 42 days. I understand that America isn't following that recommendation. Why, and what's happening there?
So what you hear from the American government is that the plan is to follow an isolation, but to make it voluntary. And that is something WHO does not have the power to kind of order countries to have in particular policies when it comes to things like quarantine, et cetera. You know, one of the core tenets of US law is that you've got kind of a high bar to meet in order to be able to contain people against their will. But they are saying they're going to voluntarily ask people to isolate. And that's actually been shown in most cases to be very effective. So I don't think we see that big of a difference when it comes to what's happening in the US.
I did also want to ask you about what some critics are saying. They're saying that the US withdrawal from the WHO has weakened coordination during outbreaks like this. So are we now seeing the consequences of that here?
Absolutely. So the WHO in the middle of this outbreak has been doing remarkable work. They were the ones who received the formal notification. They identified the virus with the help of South African scientists and others. They've coordinated samples that then were reviewed at the Institut Pasteur in Dakar. They've coordinated medical evacuations and shared passenger manifests. This is the kind of international infrastructure we need. 2,500 diagnostic kits shipped to over 12 different countries where we're seeing tracing. But the World Health Organization is also facing a major crisis right now in terms of funding, in terms of political support. Not only has the US withdrawn, but the Argentinian government has announced that they are withdrawing, which of course is the place where the virus originates. And so this situation is what you would understand to be a major crisis when it comes to global health governance. And the effects are being seen. Usually, you would see a Centers for Disease Control in the middle from the United States, in the middle of this kind of response, and they're nowhere to be found. And so that is only harming the global response to have the richest country in the world not cooperating in the way in which it should.
And Professor Kavanagh, whilst officials are stressing that this isn't a pandemic, what lessons should governments be taking from this, what's going on, and also what provisions should be in place just in case?
They're right to question when it comes to what's happening in the world right now. We are seeing a context in which, just for example, the study of this virus has been massively underfunded. In fact, the National Institutes for Health in the United States had one of the only studies of this Andes virus, and it was canceled by the Trump administration. We should be worried when we have new viruses pop up and act in surprising ways that we aren't doing enough to address the kind of fundamental questions when it comes to science. But then also, if this were a pandemic, we should be very worried, because we still have no clear way to share technologies, no clear way to fund a true global response. And we have, meanwhile, the World Health Organization facing this major crisis brought on by a handful of countries. We need a bigger, better World Health Organization. We need a serious cruise ship effort that would address the outbreaks that might happen there, and better clarity on what happens when people fall sick, so we don't end up with a ship with a body on board, critically ill passengers, and a pathogen that's spreading person to person, but still taking a week to find a place to find birth. All of these are the kinds of international global cooperation that we know is possible, but it requires a far more muscular and powerful World Health Organization, and instead we're seeing it decrease. And so hopefully next week at the World Health Assembly, we'll see ministers of health actually deciding to take some really big, bold steps. But I'm worried, because that's not what we're seeing so far.
You say you're worried. This is indeed a developing story, Professor Kavanagh, and I can tell you that there's a new line coming out. Staff at a Dutch hospital where one hantavirus patient is being quarantined, they've apparently been involved in mishandling of blood samples, and there's concern there too. So even as we speak, this virus is spreading. So how concerning is that?
So one of the things we know is that this virus, as of now, right, as far as we can tell, is not circulating widely in the way in which people should be panicked that we're going to end up with a major pandemic. There's no signs of that. There's no signs of the kind of crisis. But what that does tell us, right, is that our biosafety capacities, our training of health workers, our ability to respond to pathogens is not nearly as strong as it could be. The amount of money that the entire world spends on making sure that we have health workers who are well trained, that we have the surveillance systems that we need, is tiny in comparison to what we're spending each day right now on wars, or each day on a set of consumer goods. Those priorities put us in a context where at any moment, if this were a far more dangerous virus, we should be and would need to be worried. This one, luckily, we are probably in a place where it will be, will be able to be contained. But what it does show is that there are crucial vulnerabilities worldwide that we have not addressed. And so far, heads of state don't seem to be taking this nearly as seriously as they really need to be. We're lucky that this one doesn't look more like a COVID in terms of transmission and a hantavirus in terms of deadliness.
Professor Kavanagh, thank you very much for your analysis here on TRT World.